Royal Far West has long and deep connections with Cobar and Bourke. CEO Jacqueline Emery was recently in these towns to visit. Here's what she had to say. Could you tell me just a little bit about what the purpose of your trip was here last week?
Sure. So, look, there were two main reasons for coming out. The first was visiting Cobar Shire Council, really about our 100-year celebrations that are coming up at the end of next year. So December 2024 was when Reverend Stanley Drummond first came to Manly and had the idea of the Far West Children's Health Scheme. And, of course, Cobar is really what we consider our spiritual home because that's where he was from. And they've got a lot of artefacts, obviously, and a lot of Royal Far West history in Cobar, as well as a lot of history about the Drummonds and Reverend Stanley Drummond in particular. And we are going to team up with the Cobar Shire Council to try and raise some funds to restore the, really very unique railway carriage where we used to do the baby health checks that's based there at the Cobar Museum. So we met and had a great discussion around that. I went and visited the baby carriage because last time I was out there the museum was closed for renovations, and it just was such a thrill to go and really have a look at that history. And it was incredible to think that those health checks were happening on those carriages with our nurses before World War II.
Yeah, okay, so fair bit of history, it sounds like, out here, out this way. So you had a successful trip then?
Yeah, look, that was really good. I think, we have a commitment to work with each other around that. And then, of course, Bourke is really where we're doing a lot of work, have been in Bourke actually since a lot of history in Bourke too. So our first clinic outpost was established in Bourke in 1931. So it's a long time ago. And, the famous Nancy Bird Walton used to fly our nurses out to Bourke. And, just an incredible history of working with Bourke. And in more recent times, we've done a lot of developmental screening with children in Bourke in collaboration with the Bourke District Children's Services. And I came out and, had the pleasure of meeting the team out there and connected beginnings and really heard a lot more around what their challenges are and, how they're going, but also some of the great successes that they're having. Just met a few of the people providing services in Bourke, and it was just fantastic to get out in community and also visit one of the schools that we're working in, St Ignatius Parish School as well. And I had, again, the pleasure of meeting the principal out there and just talking about, what more we can do to help, I suppose.
Yeah, can you tell me a little bit more about that, about your relationship with St Ignatius?
Yeah, so we have and have done now for about 5 or 6 years, had a contract with the Forbes, Wilcannia Forbes Diocese, and they've just been so fantastic at really taking children's developmental health very, very seriously. And we've worked with them providing screening and assessments and therapy largely via telehealth over those past few years. And now we're trying to shift up our model so that we can actually do a bit more work on the ground in community. So I was actually in Bourke with a team of our clinicians, the head of our school services, and we're now Royal Far West is now operating in over 200 schools and preschools in 4 states. And I think it's just fantastic that our head of school services, she's originally from Nyngan and she lives in Broken Hill. And I suppose COVID's given us that opportunity that a third of our staff now are based in the regions. And, we're really keen to, fill the gaps wherever we can in services for kids. And, our team of a speechy and a psychologist and an occupational therapist were out working in Bourke District Preschool in the week that I was up there last week, which was fantastic, doing screening and assessments, meeting with parents, talking about, perhaps where some kids might need a little bit more support before they start school.
Yeah, great. If we could just take 2 steps back for a moment, for those who don't properly understand what Royal Far West does, could you talk to that a little bit?
Yeah, so really the way to think about Royal Far West is really in 2 ways. Well, first of all, we're a charity, almost 100 years old. We've been working in country New South Wales for all of that time. Probably in the last 10 years, we've started to venture into other states and territories. But we're a child development service, so we offer assessment, diagnosis, screening and therapy for children aged 0 to 12. Most of the kids that we see are between 3 and 12. A lot of the work that we do is through schools and preschools. That's where you find children of that age. And it's really fantastic because what we try and do is not only work with the child, but all of the key adults around the kids. So, we really try and engage parents in, supporting kids' healthy development, as well as building the capacity of teachers and early educators with things like understanding what signs to look out for if there might be a concern with a child's development, but also strategies to employ in the classroom. Often, if you're working with a class where there's quite a number of kids that might have a developmental challenge, that can be quite challenging for teachers, and, we will help them with strategies around how to keep the class regulated, calm, alert, those sorts of things. And, that allows for better learning. So a lot of the work that we're doing, we're seeing really fantastic educational outcomes, but also better life outcomes for these kids, and really putting them on a really good trajectory. And the earlier that you can work with children, the better success that you're going to have in that area. So we do 3 things now. Our assessment and diagnosis service, which is a sort of a multidisciplinary, it's kind of like a one-stop shop, if you like, and that's where families are still travelling to Manly for a week, and that's a benevolent service. It's free for families. Of course, our waitlist, like everyone else, is growing because of the lack of workforce in rural areas. So that's really our flagship service, has been operating for many years now. And then the other 2 areas is this work that I've mentioned that we do, working in preschools and schools. And again, we'd like to work in more preschools because, as I said before, the earlier we can go, the better. And then the third thing that we do is working in, and this is more of a recent service for us, working in communities that have been impacted by floods and bushfires. And we've been doing that work since the 2020, horrendous bushfire season. And, that's a very intensive program with highly qualified staff that really support the recovery, not only of the kids, but actually the whole community, because in those circumstances it really is a community-wide trauma. And, not only the kids, again, the educators, the parents, community members, local health professionals all need support. And we're working in over 60 communities right now, offering those supports, and a full team goes into those communities for a week once every school term, and works on the ground doing quite intensive work in that community. So they're the kind of 3 main areas that we're focusing on now. But of course, for us, we've always existed to fill gaps in health services for kids, but sadly the gaps are really widening in recent times.